Welcome to the Exam Room with your host, Dr. Rhiannon Winsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. In this episode, we take a closer look at health centers in Arizona and how they performed as part of the 2024 ACO REACH model with a focus on three key quality measures: all-condition readmissions, unplanned admissions for patients with multiple chronic conditions, and timely follow-up after acute exacerbations. We also explore what drove improvements, what worked, and why. Let's scrub in.
Okay, so today we're joined by Kimberly Gonzalez and Dr. Siri, and we're talking about lessons learned in 2024. Thanks for being here with us. Can you tell us a little bit about yourself? We'll start with Kimberly and then Dr. Siri.
Hi, my name is Kimberly Gonzalez. I'm the Manager of Population Health Analytics and Community Outreach here at ABC Network. With this new year, I'm focusing very heavily on our quality improvement and how we can optimize patient engagement and make sure that we're reaching out to those really underserved populations that our FQHCs are serving.
Awesome. I can't wait to pick your brain. Dr. Siri.
Hi, this is Dr. Siripurapu. I'm the Medical Director of ABC Network. I've been with the company for 2 years, going on my third year, and I'm excited to see where we are heading.
We're excited too, and hopefully our listeners are too. So, talking about the quality performance metrics for 2024, how we can leverage those moving into 2025. So, as an ACO that was part of ACO REACH, which is Realizing Equity, Access, and Community Health in 2024, we focused on three quality measures, right, which were all-condition readmission, all-cause unplanned admissions for patients with multiple chronic conditions, and timely follow-up after acute exacerbation of chronic conditions. So how did our health centers do overall?
So thank you for telling all those, because it always is, I always fumbling with those quality measures. But yes, those are our three quality measures for ACO REACH program. We did quite well on all three measures. We have noticed a slight improvement in all three quality measures from one quarter to another quarter. So it means we have less admissions for people with multiple chronic conditions. We have done better on timely follow-up after hospital discharges or ER discharges, as well as the readmission rates went down. So it does mean that we are doing something right. Kim?
Yeah, and I think one of the biggest changes that we saw with our FQHCs was they realized the importance of outreaching to those beneficiaries and making that first phone call and checking in on them. And so one of the strategies that we started here at ABC Network was we had our beneficiary engagement center follow up after hospitalization. Just call in, check in with the patient. How are you doing? Is there anything that's going on? Anything that needs to be addressed? What's your next steps? Reminding them to re-engage with their primary care physician. And that reminder and that phone call really helped with closing some of these goals that we had set with our FQHCs. And I think that's one of the key strategies that helped us see that improvement quarter over quarter.
That's nice. And patients need to know that we care.
Yeah.
My dog was a patient, right? And the vet clinic they called, to check on my dog. And, that really makes you feel like they care. And it didn't sound like they were just checking a box. Like, it really sounded like they were concerned for my pet's well-being.
And I think one thing we realized was we have the data available. The only thing was nobody was looking at it. And at the time it was explaining, well, how do we analyze these reports that we're getting from admission, discharge, and transfer? And so with that, once we provided that to our FQHCs, they were then able to action it and make those outreach calls, dedicate certain personnel to have the patient come in, make those appointments available. And once the patient saw that they had somebody reliable, somebody who cared about them, they knew that the next step was easy. All they had to do was come in, and then they had that follow-up appointment, and then the care was continued. And it didn't just stop at that ED or hospital visit. It continued at the FQHCs with their primary care doctor.
Yeah, and that can be confusing. Like once you're in the hospital and then you leave, what do you do next? What are you supposed to do? Who are you supposed to see? Did your medications change? All of those things.
And that's a key thing you said right there. I think the medication change and ensuring that you're managing your chronic conditions, and it goes so much further than that one episode that you had at the hospital.
That's why the first call that comes from either our beneficiary engagement center or the FQHC, asking them, hey, how are you doing? We heard you were in the hospital, you came home, we are glad, but we want to make sure everything is okay. That one call from the health center kind of engages the patient, tells them, hey, we are getting a call, checking on us. So then they say, I think I should go to see my primary care who can check on my medications, make sure I'm doing okay, see the specialist that they need to see. So that closes the loop for them.
Yeah, and I think that sometimes as healthcare professionals, we forget to use like those layman terms that patients can understand, because I know like my mom, the doctor will talk to her and then she'll look at me. Like, what did they say? If we can follow up with them and be cognizant about using words that they understand, that they're more comfortable with, because sometimes they're just afraid to say, like, I don't know what that is, can you help me out? So partnering with them.
I remember when with our beneficiaries, we were talking about A1C levels. And first instance is, what's A1C? I only see that in my labs. Like, what are you talking to me about? And as soon as you bring in diabetes, they go, oh, okay, diabetes, blood sugar, I could talk about that. We have to sometimes take away our mindset that we're not, super medical, clinical. We have to go a little bit more at what does the average person know? And eventually they become comfortable with that terminology where they can then themselves report their levels and say, okay, that is my A1C. And moving forward, as you said, they become more literate and they become a little bit more proactive. And that's what we want. At the end of the day, we want to ensure that our beneficiaries are motivated to do it themselves, and that they understand, this is what's required for my health to improve. And once they get in that mindset, it becomes a little easier too on the FQHC, because the patient themselves can do it and they don't have to invest so much time and personnel, but it's just that first step of getting them there. And then the patient themselves will buy in and want to do it themselves.
Right. So you mentioned that we're seeing improvement, or we saw improvement across all of these quality measures, and we have kind of segued into talking about drivers behind this success. Are there any other thoughts about what helped performance improvement?
I think when we started talking about value-based care to the FQHCs, it was originally, when we started, it was a new idea to them, but then they started understanding what it means. They started to get these patients in for annual wellness visits, started to address their chronic conditions, and that's what kind of helped, because the patients got more engaged. The providers understood that if we manage their chronic conditions, that is what sets them into not going to the ER or hospital for an acute exacerbation of their chronic conditions. Right. And it definitely helped that ABC team on our side. We tried to give them their discharge lists on a daily basis as much as possible, or as often as they wanted it. And also Kim here created a high-risk workbook for the FQHCs, which helped them understand who their high-risk population are, and to make sure that they can target those, because they have limited resources. So they want to use that limited resources to target those who really need it the most.
And I think one of the things that really helped us as well was a campaign to do more annual wellness visits. And so we did see an increase in those. And when the patient came in for the annual wellness visit, it was about documenting all of their chronic conditions, administering the SDOH screener, doing health risk assessments, really getting a comprehensive overview of what the patient's condition is, and then creating an action plan with that. So we saw the uptake of the care management program, which involved a care manager, CHWs, social workers, all these other personnel there to help the patient holistically, not just looking at chronic conditions, but also are there health barriers that are impacting their quality of care. Once we did those annual wellness visits, we really saw an uptake in the beneficiaries' quality of health, and we saw improved scores, and we saw less ED utilization, less IP flags, things like that really overall helped us with our measures as a network.
That's wonderful. And you mentioned, at the start of this, the health centers really didn't understand that concept of value-based care. And from what I've learned about FQHCs, they kind of treat everyone equally across the board. So this is like a big paradigm shift for them.
Yes, true. Because when we talk about the Medicare population, there are a lot of factors that play into the Medicare population. They are either disabled or aged into to get Medicare, right? Their chronic conditions are different, their needs are different. So that is what they needed to realize instead of treating everybody equally. So we tried to help them understand what their population looks like, what their risk factors are, and how to manage them better.
Right. Equity.
And yes, equity, where social factors play a lot into, those population too.
Yeah. And just taking that time to find out what they are, to ask those questions. Yeah.
I instantly think of the story that we had with one of our beneficiaries where our CHW did an outreach call just to check up as they had a recent hospital admission. And the beneficiary had told us that they weren't picking up their prescription because of the cost. Little did they know that actually one of the FQHCs already had a sliding scale program that the beneficiary was actually eligible for and could apply. That program wasn't widely advertised or known about. We knew about it because we had a database of internal resources, so we were able to refer them. But once that was done, we called in the pharmacy in less than a day. They were in that program. They were able to pick up their medication at a reduced cost and then start taking their medication as they were directed previously. And so that barrier, which was the cost, was instantly removed, and we saw that adherence then to that medication as the provider had told. And in turn, we were then able to follow up and maintain that relationship and reinforce them to go back to the PCP. But things like that are what the FQHCs really need to look at, is the accessibility of the resources and what does the patient know. And sometimes it's asking those questions to know what the issues are.
Yes, I definitely agree, because it is all about bridging that gap in care. And, it can amount to anywhere from transportation to cost, or even, technology. Technology, telehealth was utilized a lot, I think, over the last couple of years, which helped bridging that gap in care. So I think, everything has worked towards the success that we have seen.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.